amputation, it is type of the surgeries which is remove the part of the extremities. By the way, amputations old times use and for the removing of another structures also, like internal organs, for example. Nowadays, amputations primarily used for the extremity removings. And before to speak definition of this term, I want to say that extremities can be removed in two ways. Way number one, by sewing of the bones. Way number two, by cutting of soft tissues also. Only so. And according to this, there are two methods to remove extremity. First, we call amputation. Second, we call exarticulation. So remember, please, that is basic question. Extremity or part of extremity, distal part of extremity, can be removed in two ways. Way number one, we call amputation. Way number two, we call exarticulation. Now, name of these terms show the difference between them. What does it mean, amputation? Remember, I give you definition now. Amputation, it is removing of the distal part of extremities on the level of bones, in the brackets, by sewing of them. So if you decided to remove extremity in the level of bone, not in the level of joint, you should cut the bone tissue. You should perform so-called amputation. Once again, remember please, it is belong, by the way, to both extremities, and upper and lower. Removing of distal part of both extremities in the level of the bone means by sewing of the bones we call amputation. What does it mean? Exarticulation. Consequently, we remove the extremity, distal parts, in the level of the joints by cutting only soft tissues. Which soft tissues? Muscles, tendons, ligaments, capsules. But I don't cut the bony tissue. I disconnected the joint surfaces of the bones. Such kind of surgery we call exarticulation. So remember, please, amputations and exarticulations. I don't have time to speak about history of the problem. By the way, I have very great books which from ancient times up to now describe how this problem is developed. I would just want to mention that one of the oldest surgeries which we know from the historical, for example, informations, writing sources, it is amputations. You can understand that amputation is happen and performed not from the good conditions. Generally, it is provided by traumas if it's impossible to save extremity. If we have traumatical disconnection of the tissues, so-called traumatical amputation. By the way, in old times, that is the main indication for amputation. Some wars, some catastrophes, something which has happened and which doesn't have any other decision. If you will not cut extremity and ligate big vessels, the person will be dead, or due to formation of infections, or due to the bleedings. That is two main causes of the mortality from the indications of amputations. If you will not remove extremity, we will have necrosis, which is called gangrene. Person will be dead from intoxication, or if there are trauma and vessels is destroyed together with soft tissues, if you will not suture these vessels or ligate these vessels, person will be dead from bleeding. So remember, please, this is two main complications which can be happen if you will not perform the amputation. So again, I tell you, I don't have time to speak about history of the problem. Who want can come to me, I will give the books. Now about indications, guys. You can see that mainly, primary, there are two groups of indications. First one we call traumatical causes. Second one we call chronic diseases. By the way, traumatical problems much more usually indications for surgery for young peoples, usually younger than 50-55. Why? Because they are more active. Possibility of traumatization due to sport, due to profession, due to car accidents is much more than for the old persons. Vice versa, in group number 2 of indications, which is some chronic diseases, much more usually we have the group of populations after 50 years. So remember, please, it's written in common cases, primary, there are 2 groups of the diseases, traumatical problems and chronic disorders. By the way, in chronic disorders, we have not only disorders of the supplement, but we can have metabolic problems. For example, I think you listen about the diabetical ulcers of the foot region. It also can be the cause if you will not treat it completely. It will give the necrotization. Problems with innervations. You know the trophical process is regulated not only by vessels, but also by innervation. So if the big nerves is damaged, we see dystrophical processes, then atrophical processes, and finally necrotization of the structures. Or even if the necrosis will not be happen, extremity will lose its function and will be much more better to cut and to insert it into the prothesis to have some function. So remember, once again, most common cases for indication of the surgery divided into 2 groups. It is traumas, injuries, and group number 2, it is some chronic problems, mainly which is belong or to problems connected with insufficiency of the supplement. For example, thrombus of the vessels, atherosclerosis of the vessels, spasm of the vessels. So this is the situations which will decrease the arterial supplement of the extremity and will make the problems with the trophical processes inside of the tissues. Now what we need attention into the picture. I show here the main indications for the amputations, yeah? And according to indications, you can see all amputations are divided into 3 types. The primary amputation, secondary amputation, and a re-amputation. Now, what does it mean primary amputation? There are the problem. If I start to treat this problem by amputation, if I don't have any other chance, you can understand, guys, that amputation, it is last choice treatment. I will do my best to save extremity, you know. We are not frogs. If I will cut extremity, new one will not be grown. That's why I will do my best to save it. But unfortunately, there are the problems which cannot be treated except amputation anyhow. For example, we have crushed, traumatically disconnected, destroyed, for example, train traumas. You understand that the extremity is destroyed completely, it is become to some porridge. Sorry, I cannot from this porridge reconstruct it anyhow, the extremity. What should I do? Only amputation. Such kind of amputation I will call primary. That's why remember, please, primary amputation, that is amputation which is provided immediately to treat the problem without any other treatments. I start my treatment from amputation. Doesn't mean secondary. There are the problem. I do my best to treat it in another way because I'm not stupid. I try to save extremity. But unfortunately, no any benefits. And finally, due to non-effective and other methods, I make the amputation. Of course, mainly it is belong not to the traumatical, but some to chronic disorders. I told you before, vascular disorders. I told you before, some diabetical, metabolic disorders. It will be stupid to start the treatment immediately from amputation. I will use all possible modalities, I don't know, starting from therapeutical, for example, to make the correction of the level of the glucose, yeah, most simple, which I can do, and finishing by plastical grafting surgeries, yeah. But if I will see that all these methods is non-effective, samely for vascular problems, I can make standing surgeries, I can make the bypass surgeries, I can make the thrombectomical surgeries, but again, I will have some limitation of the time. Because if I will not save this cut this extremity, it will start to be necrotized. And from necrosis of extremity, which we call gangrene, we will have systemical intoxication, which can simply kill the patient. As I remember, secondary amputation, that is amputation of secondary choice. You start your treatment from another modalities, not immediately from amputation, but finally you become, because all another methods doesn't give the effect. What does it mean? Is it understandable? That's a primary modality. Second, what does it mean? Re-amputation. I think name is shown for you. Amputation after amputation. I make first amputation by mistakes. For example, stump which I forms is not possible to insert in the prothèse. It is not smooth. It has the abnormal movement. It's not stabilized. Bony tissue is not covered by the soft tissues. So huge amount of the mistake or bleedings from the scar of the amputation. So I make the new surgery, which is called re-amputation, to improve my previous problems. So once again, all amputations can be divided into three groups: primary amputation, secondary amputation, and re-amputation. In the next pictures, guys, I show for you main indications. By the way, use this. For example, it's greatly visible for you that traumas, much more usually we have for upper extremity. 77% of traumas, which is indications for the amputations, become to upper extremity. I think it's understandable. You do everything by your hands. And especially this is professional traumas, yeah? During some professional activity, you can simply damage your extremities. Mainly it is level of the fingers. Sometimes it is the level of the upper portions of the extremity. There's only 20-30% of traumatical amputations we do for lower extremity. More than 70% we do it for the upper extremity. Peripheral vascular diseases, vice versa. You know that the main problematical place for the supplement, it is lower extremity. So you can see absolutely opposite situation. 70% it is the problem of the lower extremity, only 6% it is less than 6% it is the problem. Why 6? You can say, why not 30%? Because not for all vascular disorders we make the amputation. So you must understand, but majority of the problems, of course, become to the lower extremity. And if for the traumas we speak about the young group of the population, young I means younger than 50. For peripheral disorders of the vessels, vice versa. Usually it is old persons. Of course, guys, for both these problems, little bit we have the predominance of the males, especially for physical traumas, due to the special physical works, professional activities. Much more usually this is the male problems. You can say bivascular problems also predominant. Bad habits. Unfortunately, guys, this is the biggest problem, yeah? Smoking. Till now, smoking is much more usual for the males. And the main effects of the smoking, it is vasoconstriction. And it is primary damage supplement of the lower extremity. So that is the reason why and traumas, you can see, and for example, vascular problems, mainly, predominantly, it is the problem. By the way, metabolical disorders, diabetes mellitus and ulcers, little bit more usually for females can give the ulceration and can be the cause of the amputation than for the males. Next slide show for you awful inflammations, which we call gas gangrene, different kinds of the gas gangrene. Yeah, we can have, and you can see that here we have different kinds of the necrosis. Yeah, this is the so-called necrosis with mummification, and second it is calicative necrosis, yeah, with the liquid formation of the extremities, yeah. Let's say here we have fibrous necrosis. Tissues is become to the mummificated, and you can see the structural units. For example, by microscope you can identify it is mummification of what? Skin, muscles, because structural units will not be loosed. In case of the calicative necrosis, everything becomes to soft cheese. And we lose any structural modalities, and it's impossible to understand primary to what belong these necrotized structure. The Classical anaerobical infection, for example, Clostridia perfringens, which is very quickly gives the necrotization of the deep structures. Guys, understand me correctly, I don't want now to give for you the etiology, pathogenesis, and something else of that. My subject study primary 2 questions. It is the access and the technique. But to be a little bit more understandable for you, I made this introduction. Of course, all these questions you will study during your surgical diseases. I now want to explain for you how technically we perform this manipulation. Just this is for you a little bit review for the future. Is it understandable? Very well. Let's continue. Congenital disorders. So we spoke about traumas, we speak about peripheral vascular disorders, we spoke about infections. Now the time to speak about the malformations. Congenital disorders of upper extremity, lower extremity, congenital shortenings, congenital abnormal structures like syndactylia, polydactylia, abnormal number of the fingers. Yeah. So all these situations can be the cause. For example, amputation of 6th finger. Yeah, it is due to the congenital malformations. It is also not so usual problem, but also can be happening. Next questions, guys, don't write, just look to me, listen to me. Of course, it is also not my subject. Of course, it is also you will study during your surgery, but little bit about the precursors for the surgery, what we need. Of course, we must say that 3 main important, how I can say, 3 main important conditions or situations I should provide it. Number 1, of course, it is complete anesthesia. And that is the cause why in 99.9 cases we use the general anesthesia. As you remember, guys, there are 3 types of anesthesia. It is local, regional, and general. By the way, each one gives some effects. If local one mainly provided analgesia, it is decreased the pain. Regional has 2 effects, analgesia and muscular paralysis. General one has 3, it has amnesia also. Let's say to prevent any shock reactions, of course, we prefer to use local anesthesia if it is possible. If you will make the, for example, amputation, touch wood, of course, in out of hospital condition, in some war conditions, yeah, for example, in the field. Of course, you will use another methods, like, for example, regional truncal anesthesia. It is very hard. It is very problematical because no any regional anesthesia doesn't give 100% of the effect like the general one. But anyhow, if no any other possibilities, you will must to be ready to do the surgery in the condition of it. So first, what we need, of course, it is the problem with anesthesia. Second one, of course, aseptics, antiseptics. As for any other surgeries, we must to provide it in absolutely sterile condition. Why especially for amputation it is important? If you cut the big bulk of the tissues, and if we will have dissemination by the microorganism, these cutting structures, in the future we will have awful results up to the mortality. One case, then you cut only skin and fatty tissue. Another case, then you cut all the soft tissues. Of course, the infection of so big group of the structures will give the awful intoxication. And number 3 problems, which is written here, it is very big, and I can say main work with the vessels. With the vessels and with the nerves. Because guys, you understand that then we cut the extremity, especially in the big regions, like the femoral region, arm region, of course, a huge amount of big vessels we damage. And if we will not understand how to work with these big vessels, we will kill the patient by the bleeding. Person will be killed by the bleeding. Let's say, right, please, this point is necessary to be right. Amputation, it is vascular and neurological type of the surgery because we should work with big vessels and nerves. And next sentence, please mark, because it is very important. And all these mentioned structures should be selectively accessed, open, and ligate before amputation performance. Before performance of amputation. Write it and look to me. What does it mean? Now let's imagine that in front of me there are some imaginary part of the extremity. For example, femoral region. And I must to cut this femoral region and remove together with distal portion of the extremity. Imaginary, we can choose two methods of the work. Method number one is very simple. I take some big sharp, I cut all these structures together or layer by layer, doesn't matter. And only after I find the bleedings and start to work with these bleeded vessels. Do you understand me? So, point number one, I cut the tissues. Point number two, I see the bleedings. Point number three, I arrested this bleeding. Primary, generally, this is what do you see during any other surgeries except amputation. For example, appendectomy. We cut the tissues, we see the bleedings, we apply the arterial forceps, we ligated the vessels and arrest the bleedings. For amputation, this method is unuseful completely. Who can tell me why? Why this method is absolutely unuseful, and using of this method in majority of the cases will give them mortal complications.
Because we're cutting a large area.
Sorry?
Because we're cutting a large area, selectively ligating.
Okay, I cut the large artery. Immediately, 3 seconds after this, I apply arterial forceps and ligate it. What the problem? Do you think that 2 seconds bleeding will kill us? That's funny. My question is understandable, primary, for you or not? I say that this is forbidden to cut, to find, and only after ligate. Vice versa, we must firstly find, ligate, and only after cut. What do you write just now? You written that we must to find selectively big vessels and nerves, and we must to ligate them before performance of amputations. What is performance of amputation? Cutting of the tissues. So I must, again I have this imaginary extremity. According to my subject information, I know projection of vessels and nerves. I know layer of vacation of vessels and nerves. First of all, I open them, I ligated them, and only after this I perform my amputation. Now, who will tell me why second way is better than first one?
So that we won't harm the other structures.
Sorry, once again,
So
why?
that we won't harm the other structures and organs.
But why? You just repeated what I tell you. You say that second method is better, but why? What is the benefit of this method?
Heavy blood loss.
Anyhow, I will damage the structures. Anyhow, I will cut the structures. In one case, I will cut them primary, then secondary will ligate the vessels. In another case, I will cut them secondary after primary ligation of the vessels. Now, what the benefit of this second method? Oh, friends, that is awful. That is awful. There are two problems. Problem number one, then you cut soft tissues. Who can continue? And you cut soft tissues. Usually after this, they constricted. Any soft tissue and vessels also have constrictional rate. Then you cut big artery, you can lose it inside of the big structures. You can lose it just. It will be constricted and goes to upwards. And after this, you will use not 3 seconds, but very long times to find it and separate it from neighboring structures. Friends, that is not so critically hard in the 3rd year of medical university to know about it. Problem number 2, the muscle constriction can arrest the bleeding from vessels which is located between muscles, but it will be not arresting forever. It will be arresting during the time. After 5-6 minutes, muscles will be relaxed. Stream of the blood will clean the thrombi and will give the secondary bleeding. That's why you cannot recognize some vascular trauma because neighboring muscles will be constricted. Lumen of the vessels will be closed. If you will not see this bleeding, how you will recognize that here there are the damaged artery to ligate it? Do you understand me or not? That is the reason why method number 1, cutting, finding, and ligating, is not useful. Because you will not find, you will not recognize, and you will have huge bleeding, which can kill us. What I should do? You can say, but sir, it's impossible to find each vessels. You don't need to find each vessels. You will need to find main vessels. Because all another vessels will be branchings of the mains. If you will ligate it mains, you will arrest the bleeding and from small branches. What is the main artery in the thigh region? Sorry, if I will ligate it femoral artery, I will arrest the bleeding from majority of the sources. I think it's so simple. About nerves. Why nerves also should be finded, and after we must to make, first of all, work with the nerves, and only after cut the big bulk of the tissue. The thing is simple. If you, for example, you ligated vessels and nerves, you cut it together with the muscles and bones. Which kind of problem will be happen here? Tip of the nerves will be involved inside of the scars. They will be irritated inside of the scars, and they will give so-called phantom pains. You know what is the phantom pain? Extremity is removed, but your patient have itching in the foot region. That is phantom, not real pain. And that is happened due to irritation of the nerve. You cut the nerve and muscles in the same level, scar is formed, nerve is involved inside of the scar is pressed this nerve, irritated this nerve, and it gives the phantom pains. What you should do to avoid it? Usually, you apply the dissecting forceps in the nerve, and from the level of the future cutting muscles, you little bit, by its elasticity, descend it down into 1-2 centimeter. It is not hard. Nerves is totally elastic structures. Then you cut it from the level of your future muscle incision. Nerve is constricted and goes 2 centimeter upwards. Then it goes 2 centimeter to upwards. It doesn't involve inside of the future scar formation. Sometimes, before cutting of the nerve, we take the alcohol, 100%, yeah, and inject it inside of the tip of the nerve. Why? To prevent any regeneration. You know, I don't need the regeneration of this nerve, because if it will be regenerated, it also can be cause of the phantom pains. Nevrinomas, big bulk of the nerves, will be formed in the region of scar. Am I need this regeneration if extremity is removed? No, it's stupid. Then you injected this alcohol, it is kill the neuronal tissue. And it prevent any regeneration in the future. And again, I say, you descended it to down, you cut it, it is constricted, like the rubber structure, goes to upwards and doesn't involve in the future scar. Remember, please, this is the cause why we prefer to work primary with vessels and nerves, and secondary cut only the big bulk of the tissues. Point 1, to prevent any bleedings. Point 2, to prevent formation of the phantom pains in the future. According to techniques of our surgeries, my time is very short, all amputations can be divided into 2 big groups. Listen me. Group number 1 is circular amputation. Group number 2, it is flag form amputation. I think it's very simple to imagine. Circular, it means all the tissues I cut in single level in the circular method. That's a circular amputation primary is used for the regions with single bone. If there are several bones between them, there are muscles, you cannot cut everything circularly up to the bone. That is impossible. Circular amputation technically can be provided in 3 ways: single moment, double moment, and triple moment. What does it mean, single moment? Single moment amputation, it's not the final one. Unfortunately, if you will do it, you must to perform after re-amputation. Why I say unfortunately? Any next re-amputation make the stump shorter. By the way, read in my previous slides is written what does it mean ideal stump. Ideal stump after amputation should have absolutely smooth surface. It should not have any abnormal muscular movements, deformations. What does it mean? Then you cut the extremity, you should do your best to make the stabilization of the muscles. Otherwise, like the worms, they will be moved under the skin and will change the form. How we make stabilization? For example, she is flexor, I am extensor. If you will future the tips of flexor, cut it flexor and extensor to each other, final, their work will be zero. You will make stabilization of them. You understand? Because voluntarily the person then make the movement constricted these muscles. If they will not be stabilized, they will change the form of the stump. And prothesing will be impossible. Very important to remember about future scar place. For the lower extremity, we try to not apply the scar in the inferior surface because that is pressure place. We much more prefer to have it or in anterior or in posterior surface, comparable with part of extremity. By the way, for the upper extremity, for lower extremity, thigh region, for thigh, much more preferable to have it in anterior surface because mainly posterior is irritated. For the leg region, mainly it's better to have it in posterior because anterior is more irritated. Experience is shown. Remember, please, strong scar, it is small scar. The more bigger will be the scar, the more weaker it will be, and the more easily it will be irritated inside of the prothese. The best form of the stump, it is round form with the smooth surfaces. Any angles of the stump will be future place of the ulceration because they will be pressed inside of the prothese and will make huge amount of the problems. Once again, circular amputation, as I say, we can perform single moment, double moment, triple. What does it mean single moment? Imagine like in some cartoons, yeah, you see the pirates with the bone which is located below the cutted extremity and they walk in such a way. It means this is single moment. What does it mean? All tissues you cut in the same level. But sorry, soft tissues constricted after, bone no. That's why then you cut all the tissues in same level, soft tissues constricted and goes to upwards, and the bone is remain open. Because you don't have enough soft tissues to close the stump of the bone. What does it mean double moment? Something near to it. You cut the skin with fat, you wait several minutes. Skin is constricted. In the femoral region up to 6 centimeters it will constrict. And only by margin of constricted skin you cut it deepest structures. And you will have finally like this. This is level of the skin. Muscles will be constricted and goes a little bit upwards. And in the level of the skin, you will have the bone. Again, you don't have enough soft tissues to close this bone. Usually, this manipulation we can do in emergency case, then you need quickly to ligate and remove the structures. After, you will make re-amputation. And for re-amputation, single method, and for primary amputation, single method, it is triple moments, circular. What does it mean? You cut skin and fatty tissue, you wait several minutes, they constrict it. Then you cut superficial muscles and apply the retractor, which you see it is like big dish with the aperture. You apply it, you maximally retract soft tissues to upwards into 5-6 centimeters, and only after you cut the bone. That's why you will have the stairs like this. This is the skin. Above the skin, this is the level of the muscles. And above the muscles, this is the level of the bone. So you will have more than enough soft tissues to close the tip of this bone and to prevent any future re-amputations. Now we need attention to the next slide and we will come to conclusion. This is flat form of amputations. What does it mean? It means from anterior or from posterior surface of extremity, you form the flaps. You can include it in this flap only skin with fat, or skin, fat, and muscles, or skin, fat, and muscles and bone. You can ask me why bone also we can include. I imagine that you make amputation in the leg region. Tips of your cutted tibia and fibula will be very sharp, and during the pressure they can perforate it, even the soft tissues which is cover them. What we prefer to do in this case, to form from the bones the bony plate, and to put this plate immediately under the tips of the tibia and fibula. Physical rule, the more is surface, the less is pressure. As I remember, please, the flat method has a lot of advantages comparable with circular. And first one, you can regulate it, the future place of the scar. If you make circular method of amputation, final scar will be in the inferior surface, the most pressure place. If you make the scar method with the flaps, if anterior flap will be long, posterior short, final scar will be in the back. If posterior will be long, anterior short, final scar will be in front. More of this, you are much more preserved the arterial supplement and innervation, because inside of these flaps you included vessels and nerves. Then you make circular method, you cut all vessels and soft tissues in the same level, and marginal structures sometimes lack the innervation and the vascularization. Here, inside of the flap, for example, I make the flap from anterior surface. Anterior tibial neurovascular bundle, I can include it inside of it, up to the tip of it. There are special measurement types for these flaps. If it is single flap method, remember please, the length of the flap should be 1/3 of the perimetrium. Perimetrium, it is measurement of the side, yeah? That's it. What does it mean, length of the flap? Length of the flap, it is the distance from midpoint of the base up to the tip of it. If you make more than one flap, double for example, the length of the biggest one should be approximately 2/3 of diameter now, not the perimetrium. Short one, 1/3 of the diameter in the cutted level. You must read just these two types, the beer amputation and the Pirogov method of amputation. Everything is given, everything is written. All another questions I explain and give for you. Minute attention. Am I put your attendance?
No, sir.